How does histopathology determine bladder cancer types? Imagine a tiny detective working inside your body, examining cells under a microscope to figure out what kind of bladder cancer is present. That detective is the process of histopathology, which plays a crucial role in diagnosing and classifying bladder cancer. When a doctor suspects bladder cancer, they often take a tissue sample through a biopsy or during surgery. This sample is then carefully prepared by fixing it in a special solution, slicing it into thin sections, and staining it with dyes like hematoxylin and eosin. These stains highlight the cellular details, making it easier for pathologists to analyze the tissue under a microscope. The pathologist's first step is to look at the tissue architecture and cell appearance. They determine whether the tumor originates from the lining of the bladder, called the urothelium, or from other types of cells. The most common bladder cancer is urothelial carcinoma, which arises from the urothelial lining and can grow in papillary or flat forms. Less common types include squamous cell carcinoma, adenocarcinoma, and small cell carcinoma. Sometimes, urothelial cancers show different patterns, called variants, like squamous, glandular, micropapillary, or sarcomatid types, each with unique microscopic features and implications for treatment. Next, the pathologist assesses how aggressive the tumor is by grading it. They compare the cancer cells to normal cells, noting how much they differ. This grading helps predict how quickly the cancer might grow or spread. The World Health Organization has developed grading systems that classify tumors into low or high grade, or assign a grade from G1 to G3. High-grade tumors tend to be more aggressive and may require more intensive treatment. Another critical aspect is determining whether the tumor has invaded deeper layers of the bladder wall. Histopathology reveals if the cancer is confined to the innermost layers or if it has penetrated the muscular layer or beyond. This invasion status is essential for staging the cancer and deciding on the best treatment options. For example, non-invasive tumors might be treated with local therapies, while invasive ones could need more aggressive approaches. To refine the classification further, especially in tricky cases, pathologists sometimes use special stains called immunohistochemistry. These stains detect specific proteins that help identify the tumor's molecular subtype. For instance, markers like GATA3, CK20, and uroplakin Roman 2 suggest a luminal urothelial origin, while CK5/6 and CK14 point to a basal subtype. Understanding these subtypes can provide insights into prognosis and potential responses to targeted therapies, although this molecular classification is still an evolving area and not yet routine everywhere. Emerging technologies like digital pathology and artificial intelligence are also being explored to improve the accuracy and consistency of bladder cancer classification. These tools aim to reduce subjective differences among pathologists and enhance diagnostic precision. In summary, histopathology is the cornerstone of bladder cancer diagnosis. It involves examining tissue samples closely to determine the type of cancer, its grade, and whether it has invaded deeper layers. When combined with special stains and molecular markers, this detailed analysis helps doctors craft personalized treatment plans and provides valuable information about prognosis. Always remember, if you have concerns about bladder health or cancer, consulting a healthcare professional is the best step to get accurate diagnosis and appropriate care.